Good afternoon and welcome to Heartbeat. I'm your host, Arlana Shikongo. Tonight, we will take a look at the cost of substance abuse and dependency, as well as the possibility of fatality through overdose on the heels of International Overdose Awareness Day observed on 31 August. We're joined by Senior Social Worker in the Ministry of Health and Social Services, Leigh-Ann, as well as the founder of Cornerstone Wellness Center, Natalie Bezuidenhout, who is also a social worker. Cornerstone Wellness Center is a private health and wellness facility located at Braakwater, and its primary focus is alcohol and drug rehabilitation. We will explore what signs to look out for to identify substance dependency, what facilities are available for someone who has a dependency issue, as well as the need to destigmatize addiction. Leigh-Ann, Natalie, thank you so much for joining me, and I hope that we have a good, fruitful discussion on a very much needed topic.
Thank you very much.
So to start us off, and I think both of you can chime in on this one, but I'll start with Leigh-Ann. Can we just get an understanding of what substance dependency is and what addiction is?
Okay. Substance dependency and addiction, according to the Diagnostical Statistics Manual, that's what the doctors use to classify, has been combined. So we are looking at only substance use disorders.
Okay.
And substance use disorder, well, if we can now say what exactly it is when you have a dependency on a specific substance. This means that you are using the substance, and we are talking about psychoactive substances. We'll get into what is psychoactive substances as well. But when you become dependent on them to the point that even though you have a health issue, you are still unable to stop using the substance, even though you have certain obligations that costs you to actually have to stop using the substance, like family issues and so on. You cannot stop and you are still using. So the dependency, of course, is it has different phases that it goes into. You find the experimental phase. You find the continuous use phase. You find the continuous use. You find the phase where you are now unable, or you are medicating. You are actually using in order to treat your need or your craving for the substance. And then you find the compulsive use that you cannot stop. Yes.
Okay. Leigh-Ann, I really like that you mentioned substance use disorder because, as I was doing reading to get an understanding of the language around dependency, addiction, dependency, and all of those kinds of things, I found that, as you said, the substance use disorder is the scientific preferred reference.
Yes.
But then it seems that in society or in general, everyday, day-to-day speaking, we use these words so interchangeably, dependency and addiction. And if I have a proper understanding of it, which maybe Natalie, you can help me out here, there is a little bit of a difference between dependency and addiction, if I'm not mistaken.
Yes, Arlana, dependency is where the individual's functionality is dependent on the specific substance. Whereas dependency basically leads to addiction. At the end of the day, addiction is where the substance has become, or the substance use has become out of control. So the individual does not have any control any longer over the substance that they are using. So that is
the compulsive nature of
That
it,
is the
right?
compulsive nature about the substance use. Yeah.
Okay. And with the word disorder as well, you know, this indicates that it also, in some capacity, feeds into mental health, and a lot of people find themselves dependent or addicted because they're kind of self-treating a mental health issue as well. If you can maybe give us a little bit more insight on that area of the issue.
Yeah, it's so true what you're saying, Alana. A lot of people are self-treating. We find that some people are treating a mental disorder that they had, and they found out that the substance could assist with that. Some people actually get a mental disorder because they are using, and then have to continue using in order to feel normal. If I can put it that way.
Yeah.
So it goes both ways. Yeah, but it's a mental disorder because it, like, say, a heart illness. It really has an effect on the functionality of your brain. Because people say it's a relapsing brain disease. So it has an effect on how your brain functions. Firstly, some people ask me now, please convince me, why is this an illness, you know? And I always have to then explain to them, it also has signs and symptoms like any other illness would have. You find that signs, you might say that this person is, the signs you can see, the person has fever, the person is losing weight, the person's eyes are red, the person is having the munchies, like they call it. So these are signs. Symptoms, there are clear symptoms. So you can see that the person is having certain, or not see, but the person will be able to explain to you, because these are not seen, but that they are maybe hearing things, seeing things. They have certain tummy issues, stomach problems. They have hypertension. So it's not necessarily that you can see it, but they are able to explain to you, and so those are the symptoms.
Yeah.
But also it has a pattern, as I explained previously. It has that logical pattern to say that if you consistently use and you can't stop, this is the pattern that it will follow, and it eventually leads to death.
And in terms of the symptoms that you can and cannot see, for example, of course, when you're taking a substance, there's going to be a chemical change in your mind and in your body, because you're putting these chemicals in your body and they have to interact with what's already there, right? And you had mentioned psychoactive substances.
Yes.
So let's talk about that a little bit, just to give us an explainer of what exactly a psychoactive substance is, and maybe a few examples.
Okay, so psychoactive substances, you would see that your brain works with a reward system, your central nervous system, and that reward system is what is affected by the substances. That's why it's called a psychoactive substance. So what it does, in summary, is that it affects your thought, your mood, your feelings, and your behaviors. And for some people, that is the reason why they are taking it. They want to feel happy. They want to feel normal, and this is what the substance provides for them. So, of course, that's the nature of the psychoactive substances. You find different psychoactive substances are classified in 4 categories. And these are now the depressants, the stimulants, the hallucinogens, and the last one, the opioids. Yeah. So those are the broad categories. Of course, everything else falls under those categories. And we should remember that it's not only illicit substances, meaning substances that are illegal, but people also get addicted to over-the-counter medication. Yeah.
Yeah, like cough syrup, for
Yes,
example.
yes.
People get addicted
Yeah.
to that. Leigh-Ann, if you can maybe talk us through, of course, not very specifically, but your wealth of experience in this field. I mean, you founded Cornerstone in 2013, but prior to that, you were already working in rehab facilities. So in your years working in these facilities, what are the things that you've seen in terms of how people come to a facility, how people even identify that they might have a dependency or addiction issue?
Okay. In most cases, the individual wouldn't really see that they have a problem. Sometimes it's the family that sees that they have a problem. And to convince this individual that there is indeed a problem, that is actually the challenging part. You do find clients who actually acknowledge and admit that they have a problem, and then they are the ones who usually go and seek for help. And then within the rehabilitation program itself, you would still find clients who are still in denial. A lot of them are the ones, or they are usually the ones who have been referred by families because the family sees there's a problem. So now they reach out to rehabilitation centers or to treatment facilities. And within the program itself, the client might still have a sense of denial, because I think it's all about understanding where it comes from and what addiction basically is. If I have to ask a client now, what do you understand by addiction? They would usually say it's the person on the street that drinks every single day and that doesn't have a job, that doesn't have a, do you understand?
Yeah.
So I think when we look at what addiction is, then we cannot just say that it's the person on the street, because it can happen to anybody. And I think this is the challenging part where people themselves hasn't identified that they actually have a problem. So now it's the family, or it's the employer, or it's a friend, or any other referral source that basically helps this person to reach a point where they see, okay, but now I see this is what is happening to me, and because of this happening to me, I may have a problem.
And that speaks to the stigma that exists around addiction. There's a certain way that society has painted the picture of an addict, which, as you said, Natalie, that's why someone will say, no, I'm not an addict because I'm not like the person on the street drinking every day, not recognizing that certain patterns that they're displaying indicates dependency or an addiction of sorts. So I want to move over a little bit into now the resulting factors of a dependency or an addiction. Sometimes it can be fatal, sometimes it cannot be. I think when we think of the idea of overdose, we usually think of it in the sense of a fatality, but that's not always the case, right? There's accidental overuse and then intentional misuse that can lead to overdose, but you don't necessarily always die. But if we can maybe speak a little bit to the reality of, treatment and overdose on the ground in Namibia. Leigh-Ann, I'll start with you a little bit, just from the information that the Ministry of Health has. What do the figures look like in Namibia in terms of people looking for treatment or treatment facilities for dependency issues?
Well, at this point, we are having an influx of clients, about 240 per month, that are seeking treatment. And these are not 240 patients that are regularly visiting. These are new patients.
Okay.
So there's quite a bit of activity happening, and people that are realizing that they need help and seeking the assistance that is provided by the ministry. Which for me is a good start. Yeah. So yeah, that's what we have. I know in Southern Africa, according to the World Health Organization or the UNODC statistics, there's quite a few cases of seizures that are being experienced. Seizures, people will not necessarily be able to see who overdosed and who passed on from an overdose and who actually survived the overdose. But a seizure is one of the signs that someone has overdosed.
Okay.
And the seizures in Southern Africa, I think if I'm not mistaken, it's about 5,000 per month
Okay.
that are experiencing or that has been recorded.
Yeah. Which is quite a high number.
Yes,
That's a lot of people. And then, Natalie, on your end, in terms of when people now come to your facility, for example, is that usually before they get to a point of overdose or some sort of fatality? Or what is the process usually like when people come to you?
Okay, maybe I can just give you an overview of our program. We accommodate a maximum of 8 clients per intake, and our intakes are for 28 days.
Okay.
So when a client comes to the center, most of them are actually referred by the employer or the family, which means that it's very few of our clients that actually comes from the psychiatric unit.
Okay.
So by the time that they reach Cornerstone, they are basically in a position to actually bring in this change that they need. We haven't really recorded any cases of overdose, except now recently. And maybe, I can just mention what happened to this client. He used, for the very first time, he used ecstasy. And the very first time he used 12. And he actually overdosed on that. He had no idea of what the drug was about. It was his first time use. He didn't know what to expect. The person that introduced him to it didn't really tell him how he's going to feel or how he would react to it. But he overdosed on it. Luckily for him, he could actually get some medical attention. But the damage that has been done because of the overdose, because he says that he had kidney failure in the process. His kidney was damaged during that process, and it took him 4 months to actually recover from that one day of overdose or that one period of overdose. And I asked him how long did he use it, and he said it was say from 6 o'clock in the afternoon to 12 that night. So in that 6-hour period, he took 12 ecstasy. He used 12, and he overdosed. And when I asked him, so how did it feel? Can you explain what it feels like? And he said it's terrible. It's like a nightmare. And he wouldn't want to have that experience again.
Yeah.
So our clients who come to Cornerstone, they are at a point where they are still in charge. They are still able to not control, but they are basically still in charge. It hasn't reached a point of overdose.
Okay.
But we don't know when an overdose can happen.
Exactly.
Yeah.
So what you were describing, if I'm not mistaken, would be classified as an accidental overuse, right?
Yes,
because the client didn't intend for that to happen.
Yes.
And then I understand that the other side of it is now intentional misuse. Could you maybe explain that to us a little bit? What exactly is intentional misuse in terms of speaking about overdose?
Okay, so intentional overdose would be that you know exactly what the substance can do, the substance that you are using, and you are using it to the point of overdosing because you want the resultant reaction of the substance. So you find maybe someone that wants to kill themselves through suicide. They would go on a overdose, or they would want to overdose in order to just end their life. You find that some people, I've heard of two testimonies, I would say, of people that have been using, and then they went on a journey of recovery. And as soon as they started again, they used to the point that they wanted to, like they say, they wanted to get as much in as the time that they were sober.
Okay.
So they wanted to reach all the times that they did not use. They wanted to use so that they can compensate for that time. I think compensate is the right word, yeah.
Okay.
Yeah, so they wanted to compensate for all the time lost. So in that case, it's not accidental. It's actually something that you are planning on doing.
Yeah.
Yeah.
And Natalie, have you had any clients come in that have experienced or gone through something like that, where they were trying to, intentionally misuse a drug, but then, of course, it didn't end up going the way that they had planned and they actually survived?
Yes, we have experienced, not many clients, but I have experienced, or I've worked with a few clients. There's one category of drug that we tend to not speak about, and that is over-the-counter medication. And that is where I think that is one of the most common drugs that clients would actually use to overdose on. Do you understand? But yes, when it comes to intentional overdose, I've had a few clients that, especially with crack cocaine, they just used so much that when they come to the center, they actually say that the only thought that was going through their mind was, I've messed up, so now I need to end things. Do you understand?
Yeah.
And then some of them are actually very fortunate to get over that phase. Do you understand? And to actually seek help and to go into recovery programs or rehabilitation programs or treatment facilities before it actually caused more harm to their bodies. So yes, we have had clients.
Okay. And in a case like that, for example, as I said, not all cases end in fatality, right? But there are, long-term after effects that come up because of an instance like that. Actually, both of you can speak to this. What are some of those effects that can happen when you've misused or taken too much of a drug? Leigh-Ann, I'll start with you.
Well, you see, with the different types of substances, as we mentioned them, they have a different work, like they work differently on the body. So where stimulants will cause rapid heart rates and such, depressants will then slow down your heart rate. Depressants are more likely to have you stop breathing, where say a stimulant will cause a cardiac arrest because
The heart rate.
yes,
Yeah.
it's going too fast.
Okay.
So in this case, they have a different, should I say, they have a different effect. And that different effect causes different damages to your body. Seizures is one of them. So with seizures, you know that there's no oxygen going to your brain. So you could imagine the impact on your brain in such a case.
Yeah. And Natalie, on your end?
Yes, I think with especially with the physical effects that overdose could have on a person would be they can also, because like Leigh-Ann mentioned, with the different types of drugs, especially with the stimulants, it accelerates the heartbeat. Do you understand? So a client can suffer from a stroke, and strokes sometimes have permanent damage.
Yeah.
Do you understand? Physical and psychological damage. And with the psychological effect, a lot of the clients may then suffer from depression after they have overdosed. And do you understand? So there are lifelong damage that is done.
Yeah.
But then there are also instances where the client actually was just very fortunate that that type of damage did not happen to them. So yes, I agree with Leigh-Ann. It depends on which substance, which drug category you have been using.
Yeah, absolutely. And with a situation like having depression come as a result of drug use, I feel like that would be such a peculiar situation to be in, because when you're depressed, you're looking for something to negate that feeling. Do people who, as a result of their drug use, who then fall into depression, are there many cases, or how many cases are there of these people starting to take drugs again?
Well, as we are saying, substance use is a recovering problem, relapsing problem, I would want to say. So you always run the risk of falling back into use. I like how the one psychiatrist puts it, it's like an itch, you know, and if you are aware of the itch, you or if you are unaware that you wanted to scratch it, you find yourself scratching unconsciously. You just start scratching. And that's exactly what happens. As soon as you relax your treatment or your recovery program, you find yourself falling into a pattern of into a similar pattern and wanting to use again, and probably falling back into using. So that is a possibility. But also with that, we should know that with recovering again, you find that if you are recovering, it's so often the case that you would want, or that you need to constantly reward yourself, because it's such a long journey. Recovery is quite a long journey. So I think I've now lost track of what the question was. Just talking about recovering.
No, that's fine. It was really just to get an idea or a sense of how often it happens that somebody relapse when they're on their journey to recovery.
Yeah. So it happens quite often because it's a relapsing brain disease. It's like diabetes. So if you're not taking your medication and you're not living a proper lifestyle, chances are that you will be affected and that you will fall back into a state where your diabetes is uncontrollable. So it's the same principle. It's also a chronic illness. So you should know that if you keep your lifestyle up and you continuously pursue a recovery journey, then you will succeed. And because it's such a long journey, you really need that small milestones to celebrate the small milestones that you have achieved. Yes.
And then, Natalie, with the recovery journey, as your center is part of that journey for a client, right? How does the process look when somebody is on that recovery journey while they're at the center? And then how is that maintained once they're out?
Okay. Throughout the program, we depend a lot on the support from the families. So we invite them for family therapy sessions. When it's a married person in the program, then we invite the spouse for sessions, because the addiction problem is not just about the individual. A colleague of mine once said that especially in terms of Alcoholics Anonymous, they have a saying that one person's addiction can actually have an effect on 16 other people. So it's not just about the individual in the program, it's about the family and the social environment that they are in, even the workplace. So when it comes to the recovery program, we have a follow-up program. So once they have completed the 28-day program, we have a follow-up program, a minimum of 3 months, where they actually come back to the program. We motivate them, we monitor them we do drug screening as part of the program, and then we guide them while they are in their recovery phase. There's also something that we call maintenance. Cornerstone we don't teach them to manage. We teach them abstinence.
Okay.
Yeah. So when it comes to abstinence, we also incorporate maintenance into their program. It's like when you buy a new car. You have to make sure that the tires are running well, that there's petrol in the car, that the car is roadworthy and all this. So a lot of clients actually think that when they go through a rehab program, that's it. Now they are fine, they are okay, but they are in actual fact, they are not okay. So they have to maintain, maintaining sobriety. They have to take it one day at a time. They need to work on it's like a working program. So they need to make sure that they are getting information, that they are still on the right track, that they are speaking, that they are talking to counselors, that and that they are not alone. That all the therapists, we are always there to help them, to listen, to advise them, and to motivate them, and also to support them.
Yeah.
So we have the follow-up program.
Okay.
In the program, yeah.
Okay. We have a comment here, actually, someone that's watching, Heinrich Schmidt. He says, Natalie and Cornerstone changed my life.
So sweet.
So that's beautiful to hear. And I mean, I think that also speaks to how this remains, someone does this ongoingly, and that your facility offers that seems to be a very valuable addition for people that are recovering. On the side of the state, I wanted to find out, what are the facilities available to people that have a dependency or addiction issue, and how can they access it?
Okay, so we also have a treatment center, Etikameno Rehabilitation and Resource Center. That's an inpatient treatment center.
Okay.
But at the moment, we are also exploring outpatient, because we have realized that we need to diversify.
Okay.
You find that there are some people that are unable to be attending to an inpatient program. If you consider a mother with children, she needs treatment as well, but she is unable to go to an inpatient treatment center with her children being left alone at home. So that's why we are also taking a look at outpatient. There's the mental health facility. There's also an outpatient program running there. And they also provide then different or a multidisciplinary approach to treatment. So they have a psychiatrist, psychologist, social workers, occupational therapists. The same with the Etikameno Rehabilitation and Resource Center. Okay. So it's the multidisciplinary approach that we are really providing or offering to clients. And with this, then also the aftercare is quite comprehensive, because we don't only look at just providing treatment to the client, as Natalie just said, but also the codependent family members. We also recognize that, a person, if we look at substance use, it's not just yourself. It's not just biological. It's also psychological. It's also the community around you, social, and it's also spiritual. So we also take a look at the spiritual aspects, not necessarily Christianity, but we are taking a look at how are you growing spiritually. So we have an evidence-based approach. We take a look at all the treatment models and approaches that are evidence-based, that have shown results before, and we are quite closely linked to the aftercare groups in Windhoek and in the region. So we are also promoting aftercare services. Circle of Friends is one of the aftercare groups in Windhoek, and they have smaller satellite groups in, say, Keetmans and Swakop. So we are encouraging that they also have it in the smaller areas. And we are also empowering the clients that are leaving the center to start these groups, linking them to the AA group so that they could, and thank goodness for Zoom and such meetings, so that they can actually participate in these aftercare meetings. It really makes a difference if they are part of a group and they realize that I'm not going through this alone. There are actually people that are going through exactly the same thing. Yes.
And it offers a safe space. And I think that for most people, that's what they're looking for when they're looking for help or treatment or assistance. Now, I think often the problem is that because there's so much stigma around addiction and dependency and use, first of all, like you said, it's important for people to recognize that they're not alone. In the moment, a lot of people feel like they're alone. A lot of people feel like they will be judged and they will be castigated. And I wonder if there are even people who maybe don't seek treatment because they fear being asked questions about, say, for example, illicit drugs, and whether that's something that they could get in trouble for. So in terms of destigmatizing dependency and, the need for help, what do we do as a society to make sure that people feel comfortable enough to seek treatment when they need it? Natalie, I'll start with you.
For one, I think we need to do more awareness and education. A lot of people, they don't know that there are actually help. There's actually help available. There are actually facilities that they can go to. So we have to do prevention, education, awareness programs. I know when I was at university, UNAM had a TADA, we used to call it TADA. It was Teenagers Against Drug Abuse. And then we would go out into the different schools as part of our practical training, go to different schools and actually do awareness, start little groups and things like that. And I think I may be wrong, that the awareness and education has declined a little bit. Opportunities like this is actually something great. Social media is a great platform to actually do things like this. And I think if we do sensitization and education and give the people the sense of understanding that they don't have to be ashamed, they don't have to be afraid. If you take the first step, there will be someone that will be able to help you. And then with the awareness and education programs, if we incorporate it by using the recovering addicts, those who have gone through programs, and ask them to actually do the awareness, because there's just something different when a recovering addict actually runs a program. Do you understand? Because then the client will be able to relate, or the recovering addict, the lay counselor, as we would call them, they will be able to relate to the client. And this also helps the client become less afraid. Yes, there's still stigma about it, because nobody should know that I've been to a rehabilitation center. Do you understand? And some people actually struggle with this, especially when they have to go back to the workplace. They are afraid to share with their fellow colleagues that I've been in rehab. It's like, you are a man or you are a woman. Couldn't you deal with this problem by yourself? Why did you have to go to a treatment facility and things like that? So I think most of the stigmatization comes from, friends who have been maybe using the drug with you, and they are able to actually deal with it, but now this other person is struggling. Do you understand? And so, I think if we start with that, and just continue with the education and just continue with the awareness rate, especially on school and on school level, and our children, they are even primary school level. they are old enough to actually understand.
Yeah.
Our kids today are very wise and they are smart. So I think if we start at an early age, then the drug and or the substance abuse problem, especially in Namibia, would not have to escalate to an adult phase.
Okay. And Leigh-Ann, on the side of the ministry, in terms of programming, are there continuous efforts to roll out programs? What programs actually exist at the moment that are awareness raising or educational around abuse and addiction?
Yeah. We come from a time or with substance use where people thought this is just spiritual. People are just being unnecessary or rebellious, and it's from there that we have now all these myths and stuff. So these are things that the ministry needs to focus on a regular basis. So we provide training. We have an organization called or society called the International Society of Substance Use Treatment Professionals. That a few of the professionals were trained in. And we are providing continuous training to other treatment professionals so that we get to a place where we understand that this is an illness, that it's a chronic illness. And I think there is also where the stigma starts, because if you look at a rebellious, maybe even in our language you can hear it when people talk about this person is a junkie. This person, even if we say addict, that we are actually supposed to say someone with a substance use problem, or you put the person first. And I think we all still need a lot to grow in this area, but it is really necessary that we start educating, and with that the universal treatment curriculum is then provided by the Ministry of Health. And we also facilitated the launching or the registering of the International Society in Namibia. So soon everyone will be able to join and then be part of the trainings and keep abreast with the information. But then we also have the Universal Prevention Curriculum, which at this point we have done a school-based training just to train people on how do you provide preventative services to a school. We always thought that, like Natalie is saying, we should send someone that is a recovering addict to a school. And, if I can remember in my days, if someone goes to a school, what do they talk about? How they had or how they were addicted to a certain substance, and now they are fine, and they got out and they are fine, and they are working and they are functional. And sometimes this paints a different picture for a learner than it's supposed to paint. You're supposed to tell them how dangerous this is, and in fact you are telling them that you can actually get out. You can go in and you can start using, and it's okay. You will end up successful at the end of the day. And these are things that we actually had to learn, and it's quite insightful to go through these programs. But those are just two of the programs that we are running at the moment. Of course, there are other treatment programs that we are starting off with. Not only are we doing the inpatient and the outpatient, there's stuff like harm reduction that needs to be done. There's aftercare programs that needs to be run. Case management. Someone with a substance use disorder has ambivalence the whole time, and you having to talk to this person and tell them your problem, having to talk to the next person. It in general, you don't want to tell the whole world your problems. So we are encouraging, or we want to facilitate a case management program where people can actually have someone walk the path with them. And there's other programs. Families need to get involved, and we are engaging them with stuff like Recovery Ally programs.
Okay.
So just in a nutshell, there's quite a lot happening, but yeah.
Okay. We have a question here, I think a really important one, from Pancho Mulongeni. He asks, to what extent does the ongoing criminalization of drug use impede people accessing these services, whether those in the Ministry of Health or others, such as Cornerstone? So, in brief, the question is, to what extent does the ongoing criminalization of drug use impede people accessing these services? Natalie, we talked about this a little bit in terms of, and I think I mentioned it before as well, the criminalization aspect. How does it block people from actually seeking help and services? Natalie, I'll start with you.
With Cornerstone, we actually, or let's say when we do have a client who has a criminal record, who has to go to court for, let's take a petty crime, for example. In such instances, they are actually allowed to have a choice. Like the one who represents them can say, okay, this is the first offense, so we would either let this person go into a treatment program because the criminal offense was as a result of drug abuse. So they are actually given an opportunity to go into a treatment facility to address that specific problem that they have. With regards to, I'm not sure about the correctional services today, but I know that they also had rehabilitation programs within the prison service, helping inmates who have been charged with drug dependent crimes and things like that. So they are actually, in some instances, they are allowed to participate in programs. When it comes to Cornerstone, we actually, when they ask us to write letters to court, requesting, and this request usually comes from the family, because the family would then identify and say, okay, this is the reason why my child broke into a house or stole this or did that. So we are coming to Cornerstone. Will you be able to assist us with treatment for this family member? We would write a letter requesting that the court look at mitigating circumstances for that person to actually go through a treatment program. Yeah, that is, so we do look at instances like that.
Okay.
Yeah.
All right. And with the ministry, are there any safeguards to protect someone who, when they come seeking assistance or they come for a program, that there's some sort of assurance that they will not get in trouble for having, used a certain drug, especially if it's illicit?
Yeah. They are there for treatment. So that means that we are supposed to provide that treatment, and that is what we do. We should also know that someone that is, like we are saying, diabetic doesn't necessarily go to prison because they have eaten something or, So we keep in mind that this is an illness, and people who are seeking treatment to recover from that illness. And that is what we provide. People with criminal records, because we have case management services on site, they are assisted through the process of the criminal proceedings. So at this point, that is where we are. Yes, it does have an effect on someone that's seeking treatment if you know that actually this is regarded as a criminal offense. Yeah. So it's also something that has been researched. We had a rapid research done by a Professor Strydom, who then did consulted with us on the policy called the National Drug Master Plan. So this is something that is incorporated in the National Drug Master Plan, and soon it will take motion. And we will see some changes with regards to that.
Absolutely. And I think that it's much needed in, Namibia, like most of the world. It's important that we set up environments that that assist people in this capacity. And with that said, I think from both ends, from private facilities, state facilities, we're seeing that there is assistance available, and it's up to us as a society to destigmatize substance use disorders so that people know where to go and that there is help available, and that there are people that will walk with them along.
Yes.
That journey, be that private, be that state, it is there and it is accessible. So Natalie, Leigh-Ann, thank you so much for taking some time to come discuss this with us today. We are at the end of our show. To the audience, I hope that there has been some informative information. As always, we are always going to take questions which we can pass along to our experts. So please do feel free to leave those in the comments. And from us in the studio, that's the end of the program. I'm your host, Arlana Shikongo. Good night.